Welcome to Baby Snugs and Coffee Mugs. I'm Krista.
And I'm Kelsey. We're both labor and delivery nurses from Minnesota. In this podcast, we'll be covering all things pregnancy, delivering in a hospital, and caring for yourself and baby postpartum.
This podcast is meant for educational and entertainment purposes only, so please seek medical advice from your healthcare provider. We are so excited for you to join us, so grab your coffee, snuggle up, and keep on listening.
Cheers!
Cheers! Welcome back, everybody, to episode 11 of Snugs and Mugs.
Welcome, everybody. This week, we are going to be talking about scheduled C-sections. So there are times that you are automatically just going to be put down, have a day that you're going in to have a C-section. That could be because baby is breech, which means head is up and you can't deliver vaginally that way. If you are having twins or multiples, you can always just opt for a C-section right off the bat, or multiples you have to, I believe.
Yes, if baby A is breech, the one that is lower down.
Yep. If there is some type of pregnancy medical diagnosis that you have to have one, that's always a thing. Otherwise, if you've had a C-section before, you can always just opt to have a C-section again.
Yep. So let's kind of talk about the process of your scheduled C-section, guys. So typically they would like to schedule you in the morning. Ideally, that's the best case scenario. And you are going to have a call coming to you within the few days prior to your C-section from most likely a nurse in the clinic that's just going to go over some education and kind of prepping you for the day of the surgery. So they're going to tell you about a scrub or a shower that you're most likely going to do. They're going to give you this special soap and they'll instruct you either before a bed shower, a morning shower, or both, depending on the facility you are having your C-section at. And then they're going to tell you when you are going to have to stop eating and drinking. When you have to go into surgery, they want you to not eat for so many hours and then not drink for so many hours. So they will let you know when you're going to have to stop that the night before your C-section. And this is going to hold true until you are through your surgery and you're through your first initial recovery period, and then you're able to eat or drink. So it's kind of a long time. And then we typically have our patients arrive 2 hours before their scheduled time for their C-section. And it is really important, guys, to be on time. We don't get to pick the time of the surgery. It is all on the operating schedule. It's surgery schedule. So when it's your time to go, it's your time to go. So if you are on time, it gives us enough time to get you prepped, ready, and then time for questions if you have those.
Yeah, so let's talk about the prep that we have to do and kind of why we're kind of making it such a big deal to come for that 2-hour mark. Right off the bat, we're going to bring you to your room. You'll go directly to where you're having surgery. They'll register you. We'll bring you to your room. We'll have you change into a hospital gown. Typically right away, we're checking in on baby, whether we're just going to dop tone or watch baby for a little bit on the monitor. Then we're going to go through a bunch of questions with you. That's just for any admission process. We're going to go through what we call triage and admission questions. It's kind of generalized questions and pregnancy-based questions. Next, we are going to start an IV on you. We do that pretty quickly because we want to start fluids on you as well. You have not been able to eat or drink, so we need to get that body rehydrated.
We don't want you to be completely dehydrated going into a surgery, guys.
No, you won't feel good. So we typically want our facility at least wants a full bag of fluid in before you go back to surgery, which is why we start that IV right away.
Yep.
In the meantime, orders will be going into your chart. Lab will come up and they will draw some more blood. We always want to have your blood type on file, even though we already have it. We always do it the day of a surgery as well. And also we're going to be checking your hemoglobin. So it's basically just watching your blood count before surgery if we have to check it after surgery to watch for that blood loss. Yeah. Let's see, what's next? We also will be shaving where your incision's going to be. So I feel like everybody's like, you're going to do what? And it's a little electric razor. And
it's not a professional shave job, guys.
No, and it's just mainly getting those hairs out of the way to prevent infection.
Yep.
And then we're going to wipe it down. We have certain wipes that we use, and that's just, again, a second base cleaner. During this time, we're, explaining the process to you, how it's going to go. The support person is going to get kind of like a painter's robe, honestly. Yeah. So it's a full body cover up suit. They get booties, a hat, a mask. So we'll explain all of that too.
That's for them to wear so they can go into the operating room with you.
Yeah.
Other things we're going to put on, we put on these, they're called SCD pumps. They go on your legs, if you ever heard of them before. If not, they go between your ankle and your knee. And during surgery and then after surgery while you're in bed, they are hooked up to a machine that pumps them up. And it helps kind of move the blood in your legs to prevent you from getting a blood clot from laying in bed for so long. So typically we will put the actual, like the sleeves, we call them, on your legs, and you will walk back to the OR with those on, and then they have the pump back there that they kind of initiate that happening. And then while you guys are waiting in your room, you're most likely going to see a few different people popping in and out during the time that the nurse is kind of prepping you and getting you ready for surgery. So people you are most likely going to see is the provider, so the person actually doing your surgery. The person that is assisting you might see. You might talk to the anesthesiologist, and then perhaps their assistant as well, like a CRNA. So there might be a few people coming in and out. This is your time to ask them questions. They're going to go over the consent form with you at that point. And then you might also have an ultrasound done. So one of those providers will most likely bring in that ultrasound machine, and say you're having your surgery because your baby's breech. They want to make sure that that baby is still breech, because there is a chance, it doesn't happen that often this late in pregnancy, but there are times where babies do flip and all of a sudden they're head down and you might not need a C-section anymore. You might be able
I've seen it happen.
Yeah, have a vaginal delivery. And then sometimes, depending on the provider or any kind of medical things going on with you as the patient, they might want to just see the positioning of the baby so they know what to expect when they go in and they are taking the baby out. So just kind of be prepared that there is a chance they might do a bedside ultrasound quickly. And then it's kind of ready to go back to the OR. So before we do that, there are 2 medications that we will be giving you before you go back. So one, we give you some IV antibiotics. This is prophylactic. Since you are having surgery, we are trying to prevent infection. So that is the first thing you will get. And then you will get something called Bicitra. And it comes in this little cup, and it's a really, really sour medication that is meant to help neutralize your stomach acid. So hopefully preventing you from irping up acid and kind of throwing up while you are back in the OR.
We kind of laugh and smile because it doesn't taste good. I've never tried it.
I have never tried it either. Nobody likes it. No. 95% of patients think it's terrible. It is super sour. They compare it to like a Warhead or really sour candy. And then you have your rare 5%. They're like, ooh, that was yummy.
Yeah. I'm like, did I psych you out enough to make you think it was going to be that bad that now it tastes good?
So I always tell my patients, I'm like, just take it like a shot as quick as you can, get it down the hatch, and then you're done.
You won't miss drinking.
Yeah, it just is. Ugh. Most people think it is really, really terrible, and they make like that like little kid sour face after they take it.
Oh, yeah, absolutely.
So yeah, those are the last kind of 2 things we do right before you go back to the operating room.
Yeah, so we are at this point then waiting for surgery to be ready for us. Mm-hmm. So as soon as we get that call, that's when we're giving those medications. We will be walking the mom back only at this time. So our ORs in our facility are on the same floor. Yeah. So once you're checked into your room, we'll bring you right back to that room on the OR on the same floor. I don't know if other facilities do that. I actually have no idea. Yeah, so if you are curious about that, just ask your provider if this is your plan. The support person waits in the room during this time. Mm-hmm. This is when I tell them to get dressed and to remember to bring a phone back to be able to take pictures.
Yep, don't forget your phone, guys.
And then somebody will come back and get your support person when it's time. Mm-hmm. So we will walk the patient down to the OR. That is when you are going to meet even more people. It can be a little overwhelming. So there's going to be a couple familiar faces, but also everybody's in a mask and a hairnet and gowns. And like, you just aren't really going to recognize people either.
Right.
We are going to have you sit on the side of the bed. It is a very small bed. It's a very narrow bed. You're like, I'm not going to fit on that, but you do.
It is really, really narrow, guys.
If you have not met the anesthesiologist yet, this is going to be that time that you for sure will, and that is when they're going to do your spinal.
So what they have you do is they have you sit on the side of the OR table. You face away from the anesthesiologist. They'll have you hunch over. They clean off your back. They insert a needle, give you your medication, remove the needle, and that is the spinal. We're not going to kind of dive in any deeper than that. They can talk to you about the medication they give you and all of that. But after that part is done, then we are going to lay you on the OR table. So as Kelsey said, it is really, really narrow. So we lay you down. We call it a bump. It's like, looks like a little bag of fluid.
It's like a little gel pad,
Little gel pad, yeah. We put it under one hip so you're not completely flat. And then they have two little boards that go out on the side and your arms go out on those. So you're kind of shaped like a T. So I feel like for me, this is when my patients start to get really, really nervous.
I agree. Just because you are laying on your back, and first of all, no pregnant person wants to lay like that. And then we are having you put your arms out.
Yeah. And now you're starting to get numb, and I think the anxiety typically kind of kicks in right at this point. So if you're feeling anxious, if you're feeling nauseous, let the CRNA or the anesthesiologist know, and they have medication right there for you. And I feel like most women need something for nausea. I think most of my patients do.
I would agree every single time. Yeah.
This is just a lot. All of this is just a lot. So once they lay you down and they let that spinal start kicking in, they're going to do a few other things to kind of prep and get you ready. So what we typically see is they will do what's called a vaginal prep. So it's like a betadine swab, and they kind of clean out your vagina first. Then they're going to place a Foley in. So we kind of touched a little bit earlier that you're not going to be out of bed. That's why we put those pumps on your legs. You're also going to have a Foley catheter in place for at least the next 12 to 24 hours is kind of typical. If you're having a morning C-section, I feel like most of my patients either have it out later that evening, like before bedtime, or right away the next morning, like 6 a.m. the next morning.
Yeah.
So kind of depends on the situation, but just know you will have a Foley placed. As they are doing that, they will put a pulse ox monitor on your finger and a blood pressure cuff on you, and some monitors to monitor your heart rate, your blood pressure, your oxygen. And so anesthesia is all in charge of kind of monitoring all of that during the surgery.
And your primary nurse will be with you this entire time, at least at our facility.
Yeah.
So the nurse that checks you in and gets your day ready, I am never leaving my patient's bedside.
Nope. You are with them that whole time. So while anesthesia is kind of covering their stuff, after you get that Foley placed in, you're going to get another scrub on your belly. So I know this seems like a overkill, guys, but you do not want a wound infection. So they do this one's a betadine scrub, and then that one has to dry for a little bit. And then after that is done, they're going to put a drape up. So there's kind of a sticky, tapey, clear looking stuff that's going to go over the belly so they can still see your abdomen. And then there is going to be, we have blue, I would assume everyone has blue colored drapes.
That's a great question. I have no idea.
I would just assume so. I feel like all sterile stuff's blue, right?
True.
And so they pull this drape up so it's kind of, you're laying flat and it's over your face so you cannot see through that, and neither can your support person. Warning to everybody. Everyone says that it smells like crayons, and it really does.
It does. A box of crayons. If you opened a box of crayons, that is what the drape that they're going to put up smells like.
So it's a little weird, but once they get you all draped up and you're really, really ready, they're going to do what's called a pinch test. So the surgeon is going to take a tool and they're going to pinch different parts of your abdomen to see if you can feel or not. If you are not able to feel it perfect, they're going to bring your support person in and we're ready to go. If the off chance you can feel them pinching, they can wait a little longer, let that spinal set up hopefully a little bit more, and then hopefully it works. There are instances where it does not work and you are able to feel. If that is the case, although very rare, they do have to put you under general anesthesia, so you will be going to sleep for your surgery. If you do go to sleep, I just want to warn people, your support person cannot be in the operating room during the surgery. So I feel like make sure you're asking if this is the case at your facility. I'm assuming it's the same everywhere. But I always feel bad when like the support person or even the patient doesn't know that that's going to happen. And then all of a sudden I'm like, you can't come in, and you feel terrible.
You do. And we're not trying to stress you guys out and like tell you that that's probably, there's a chance it's going to happen to you, but this was the purpose, to just kind of warn you.
Yeah. So if you know you're having a scheduled C-section, just be like, hey, if I have to go to sleep, can my so-and-so person be in the room, just so you know ahead of time.
Yeah. And preparing yourself, I think, always makes the situation a little easier.
Yeah. So whether or not you are able to be in there, at least you know ahead of time. It might make it a little bit easier.
Yeah.
But so say your support person can come in, you're not able to feel any of the pinch test. They come in, they have their little outfit on, and they have their phone with them, and we sit them right next to the mom's head. We have a little chair for them to sit on. And if you are not good with blood and with surgery, it is okay. Just please tell somebody. If you are the support person and you are not feeling well, let somebody know so we can either get you out of there or get you in a safe spot so you don't fall on the floor.
Yeah, this is a great point, actually, because it gets very warm back in the OR. So not only are ORs like sometimes warm anyways, but we're turning heat on for that baby.
Yeah.
So if you're already kind of not feeling good and you start to get warm, you are ready to pass out. It has happened. We have watched dads go down. So just tell us, because we can prevent you from passing out.
Exactly. And no big deal if you don't feel good. It happens.
It does.
So, all right. So now it's time for the baby to come out.
Yeah. So as soon as the support person gets next to the head, they're going to start that surgery. So baby should be here within like 5 minutes, maybe 10. It goes actually pretty quick from here on out. So baby comes out. We typically will do a 30-second delayed cord clamping for a C-section. As long as baby's doing all the right things, making little noises. If baby's doing really well, they'll pop up that baby over the curtain so you can meet your baby for the first time. And then they'll bring the baby over to the warmer where your nurses are. There's going to be 2 nurses over there, the NICU team if needed, but that's only if needed. Otherwise, those 2 nurses are going to be drying and stimulating pretty vigorously. Yeah. So the difference between a C-section and a vaginal delivery for a baby is a C-section doesn't get the squeeze that a vaginal delivery does. So it doesn't clear their lungs as easily as a C-section does. So typically we're helping the baby clear their lungs, whether that is making them cry as hard as they can, and we will keep them crying, or sometimes we also have to suction them. We sometimes have to take a tube to suction down to their belly. That's all very common. Yep. Another thing I want to talk about that's common is CPAP, and that is a little mask that's going to go over a baby's mouth and nose. It is going to push air into their lungs to help open up those lungs a little bit bigger and take those deep breaths for baby. Typically, we're not even needing to use oxygen with it. It's just really air that's being pushed in. If oxygen needed, then that's okay too. But always the goal is baby just kind of comes around, starts crying, starts pinking up. We're doing the APGAR scores at that time. They're at 1 minute and 5 minutes. We're overlooking baby, assessing, seeing if there's anything different, or if everything looks okay. We're taking vital signs. And if everything's looking good at that 5 minute mark, I am looking over to mom, seeing how she's feeling, and asking if she wants to do skin to skin. I will warn everybody, not everybody feels good during surgery.
No.
So
I feel like most patients don't.
They don't. Good, to be honest. No. And if you are not ready to hold baby yet, that is okay. We will wrap them up nice and warm and give them to your support person to hold. You can hold them and change your mind at any time. Yeah. And just, it's okay. We'll get you skin to skin as soon as we can, as soon as you're feeling better.
Yeah. And some people, even if they're not feeling the greatest, they still try skin to skin. And if you want to bail out at any point, that's fine. And if you want to do it the whole time, also fine. Yeah. So it's kind of you're directing what's going on with you to tell us what to do with the baby.
Yep, exactly. So say you want to do skin to skin, it's kind of up more towards your neck just because there's not a whole lot of room. Typically your support person or your nurse kind of has to help hold baby because it's an awkward angle. And you guys are just hanging out there snuggling. If a baby is nice and calm, we just kind of let you be. If they start to act like they want to eat, if they're formula feeding, we will have formula back in the OR and the support person can help do that. Or if you want to breastfeed, we can make it happen.
Yeah, it is awkward.
It is so awkward.
But I have done it.
We have, and
Yeah.
we are the ones holding typically.
Yeah.
And we're helping and, we're touching and doing all that, and it's upside down, but it works.
Yeah, I know. It's a lot of extra hands on deck, but if your baby is ready and you are feeling comfortable, there is no reason why we can't help you assist in a breastfeed while you're on the operating table. You won't be doing a whole lot, and it's probably not that beautiful looking first breastfeed you probably see on social media, but your baby's hungry and your baby's eating, and it works out.
Exactly. And then during all this time, we can be taking pictures for you, and a support person can be taking pictures of baby, and it does work out nicely.
And just going back to when Kelsey had said we had the baby on the warmer, I always encourage my support person to come over, take some pictures of the baby.
Yeah.
Because those are kind of your first few pictures that you can get when the baby is born. And sometimes, depending on like if we are suctioning and stuff, they're over there for a little bit longer than we want them to be. So that at least you can be there and be the one next to the baby and taking some pictures so that you and mom have those afterwards.
Yeah, I'm also known to just go take the phone.
Yeah, I do that too.
Fun fact, an iPhone, I don't need to know your password. I can just hit the little camera button and it takes me there.
Yeah, definitely. I do that all the time. I've had multiple patients too where like, say the support person cannot be in the operating room. I'm like, hey, if you don't mind, I will take your phone or take her phone and I will take some pictures if you guys are okay with me taking pictures of the baby. And they're like, oh my gosh, yes, thank you. So, talk to your nurse because they can always take some pictures for
We're
you.
just second job photographers.
I will not charge you for the photos because I make no promises on how good they are, but hey, a picture's a picture, right? So while kind of all this things are going on with the baby, going on with you, you're getting kind of closed up at this point, and most women aren't really even paying attention to what's going on with the surgeons and the end of the C-section. And so they're kind of closing everything back up, and once you are completely done and the baby is looking fine, you're looking fine and stable, they'll kind of clean you up a little bit, move you to a bed, and at this point is when we're going to go into the PACU phase. So PACU stands for Post Anesthesia Care Unit. So in our facility, we most likely recover in our own rooms. This might not be the scenario where you're having your C-section. So this is another good question to have ahead of time is, after my surgery and I am in that initial recovery period, where do I go? Where do me and the baby go? Do we go back to our room? Is there a unit we go to? It's just nice to know where you're kind of headed, if you're going to be in the comfort of your own room or if you don't get to do that right away, if that's not an option where you're at. So while you are in PACU, you are the patient of the PACU nurse. So your OB nurse will still be there to take care of the baby, to help with breastfeeding, to kind of watch bleeding and help with fundal checks if the PACU nurse needs assistance. But the vitals and your kind of initial recovery is with the PACU nurse.
Yep,
They're the one that's going to give you pain meds, make sure that your pain's under control because you did just have a major abdominal surgery. And I try to reiterate this to my patients all the time. I think it gets like misconstrued in people's brains because you're awake for it. So I think like, I don't know, as like a general public, people think that it's not a big deal, but it is a major surgery. It just throws people off that you're awake.
I have to tell patients that all the time.
Yeah. So I'm like, you are going to feel pain. So in this initial period, if you are having pain, that is the person that you're going to say, yep, I need something. And they will take care of your pain control at that point. And then us OB nurses will be there watching the baby's vitals, helping you feed the baby. We can do all the meds for the baby if you choose to do those. We'll do all their measurements, weigh them, get their length and all those kinds of fun stuff and footprints. And so we're still in there. We're just kind of the baby's nurse and not your nurse.
Yeah, and the PACU nurse can be in there for a variety of time. So they can be in there for anywhere, I would say like 15 minutes up to an hour. So they are essentially waiting for you to be able to wiggle your toes and get a little bit more feeling in your legs, and then keeping that pain under control. I know a lot of PACU nurses won't leave if you're still pretty painful. Yeah. So, and hopefully that's not the case.
Yes.
A lot of people come out of C-sections doing really well.
Yeah, some people just like, they wear off that medication just so fast, and other people it just takes a little longer, and yeah, it's okay. It's just how your body metabolizes it. So as we have talked, we don't want to overwhelm you guys. We've said this multiple times, but we're trying to split things up so that you don't have to listen to our voices for an hour straight.
Trying not to bore you.
So this kind of is ending our scheduled C-section episode. We wanted to kind of stop at the point where you're done with PACU. Now you guys are officially out of that phase. You're back into your room. or you're back onto your unit if that's what's happening at your facility. So we kind of want to stop there for this episode. Next week, we're going to talk about the next kind of few days that you guys are going to be there. Typically, most women stay 3 days after their scheduled C-section. If you've had some before, some people will leave day 2 if things are a little more complicated or you need a little more help with things or you're painful, whatever it may be. I've had patients stay 4 days, but the typical is a 3-day stay after a C-section. So next week we're going to kind of transition into what happens after that PACU phase until you guys are discharged home.
Yeah, so as always, if we missed anything, if you have any questions that we didn't touch on, please send them our way.
Yeah.
We are excited to hear from you guys, and we want to know what you guys want to know.
Yep.
So
Exactly. Well, thank you guys for listening, and we will talk to you again next week.
thank you.